When you're told you need joint replacement, it's easy to think that the surgery is the thing that you need to prepare for. However, there's another part of preparation that often gets overlooked: taking care of yourself while you're waiting. Today, we're going to talk about 3 ways that I prepared and 3 areas that I wish I had understood better before I became a hip replacement patient. Welcome to From the Hip. I'm Tiffany Anderson. I'm the health educator who became the patient. After multiple surgeries and years of recovery, I've learned that there is life after joint replacement. Each week, we'll answer one question that I wish someone had answered for me. In last week's episode, we talked about searching for your surgeon, and I encouraged you to look at the search as an interview process because, after all, the surgeon is the service provider and you, as the patient, are the consumer. Because right now, you're investing in your future and better preparing yourself to protect your independence. Pain management is something to be talking to your doctor about. Full disclaimer, my background is in health education. I'm a patient advocate. I am a wellness coach. This discussion is about how we can better manage with things that we can do at home, and I'm talking about lifestyle behaviors. There are any number of things that we have in our control, things that we can do at home, along with any of the medications prescribed by our medical professionals. Those things work hand in hand to better calm ourselves and help us to minimize the pain that we're feeling, even the pain that we're anticipating in the days and weeks ahead. And on the topic of pain management, stress management, those two go hand in hand, because a lot of times when we're really worked up and feeling really overwhelmed and stressed, that will exacerbate our pain and sometimes even stimulate the pain that we already have going on. And that can compromise our lives in many realms. How are you managing stress and pain in your life right now? Taking deep, regular breaths is a way to help calm your mind, calm your brain, calm your heart. And when we're shallow breathing, when we're holding our breath, we're adding to the anxiety. We're actually starving our brain of oxygen. And then what happens? We're not thinking clearly. Breath work, as simple as it might sound, it offers immediate results. And I'm inviting you to take a few deep breaths with me right now. And I'm going to add in something a little different that will actually help to calm your mind. So we're going to inhale through the nose and then exhale through the mouth to a count of 4. So inhale. Exhale. Next one, inhale. And exhale. Last one, try and go a little bit slower this time. Inhale. Just in those few seconds, aren't you feeling a little more calm, a little more relaxed, and perhaps just even watching, not even participating? There's something soothing. It's like when you're watching a baby sleep. We have that automatic response where if we see someone yawn, we tend to yawn. If we see someone sleeping, relaxing, it automatically draws us and calms us. We're very visual. We have all of our senses to take into consideration as we're better managing our stress. The added step with breath work is something that I was introduced to when I started studying alternative therapies back in the late 1990s, and it's a technique called palming. I'm going to take my glasses off. What you're going to do is just take your palms and rub them together gently. No aggressive action needed. You're simply warming your palms. And this is ideal, especially if you have dry eyes, if you experience headaches. And with the breath work, then also leaning your head forward and placing your head in your hands, and you're using your palms across your eyes. And that's all. Something this gentle and this simple. When you close your eyes behind your palms, your eyes will automatically start to water a little bit, simply because it's a natural response from your body. And no doubt you can feel the heat from your hands. This is simply another physical cue that you can gift yourself, and something that's quite discreet. And so you can do this anywhere. It's a way to moisten dry eyes and, again, just help you to relax while you're taking those short, steady breaths. It's a simple technique, and it's helping you to relax, to tune into your body, and to better listen, and to gift yourself with just a teeny moment, because any time that you can gift yourselves moments like that, then you are reducing the cortisol levels. And that's what stress does. It sends extra cortisol through our body, and that's not doing us any good right now. The more that you can relax, better manage stress, it will help you also to better manage your pain. All of the ways to better manage pain and stress, I call that soothe. There are any number of ways that I soothe my body because I have multiple chronic conditions. Maybe you do as well. And that means that I have a lot of symptoms to manage. And so I have my favorites that I use on a regular basis. And sometimes I just pull in things that I need on a more acute stage when an injury or something happens that's more immediate. By soothing the body, then I am better managing my pain. And that's what I'm inviting you to do as well. The area that I missed with pain when I became a joint replacement patient is not really understanding the complexity and how challenging it could be at times. And what I learned as I worked with my healthcare providers and took the time throughout my recovery to ask a lot of questions was that by trying alternative therapies, by utilizing all of the Western methods available to me, I found that variety, that helped me to better manage my pain. And I encourage you to talk to your doctor and seek out a variety of methods, because we are all unique. You have different health needs than I do, and there's something out there for everyone. The second way that I prepared for surgery is focusing on nutrition. Food is universal and, of course, very necessary. And as you're preparing for surgery, your nutritional needs may have changed, especially based on the medications that you're taking right now. When you're talking about food, that can be very personal because food has meaning in our lives. Food is linked to all sorts of celebrations, it's very social, and at the end of the day, food is the nourishment, the nutrients that we need to function well. So let me ask you, when you're hungry, truly hungry, how do you feel? What are the feelings that come to mind when you're hungry? And sometimes we don't always identify those because many people prefer to graze and eat little meals all throughout the day. Others practice intermittent fasting and maybe are only eating 1 or 2 meals per day. There's all different ways that people find that how they eat works best for them. When you think about how you feel, that's another way to just really tune into your body, because now more than ever, as you're preparing for joint replacement, this is when you're going to be almost overly aware of things that are going on with your body. And as you head into surgery, then that heightened state of awareness is going to be in your favor, because your body is calling out for help. And now is the time that you want to answer that call for help with kindness and care. And the greatest way that you can do that? Nourishment. Food is comforting. Food is delicious. Food is beautiful. It's something that brings a lot of enjoyment to our lives. And you can certainly do that with foods that are healthy, foods that are going to be beneficial, because the foods that are actually sabotaging your health, those are the ones to consider avoiding, especially before surgery. Ideally, after eating a meal, you're going to feel energized and satisfied. And avoid any of those times when you feel bloated or discouraged, disappointed. I've been there. I've done that. There's all sorts of times when I've been guilty of diving into a bag of potato chips, eating the whole thing, and then I'm immediately angry with myself. Addressing the reasons behind emotional eating is something that I did with a healthcare provider years ago. And I put together a video about emotional eating, and I'll link a card to that here. There's a great book by Dr. Doreen Virtue that talks about cravings and the emotional links to those cravings. And it's especially helpful for women or anyone out there who feels that they're eating emotionally rather than really tuning into their hunger cues. Now, all of this talk about food, this is all about my concept that I call Nourish, because in my world these days, food is medicine, and food is something that I invest in heavily, because the more that I have improved my diet over the years, the better that I feel. I was able to get off medication and change the way that I nourish myself. What I'm asking you to do is to consider a meal plan that's going to be giving you the best fuel possible, something that you enjoy, and something that you're going to follow, and something that is an investment in your health, especially now as you're preparing for surgery. The final area that we're going to be looking at, something that I invested heavily in, is sleep and getting enough rest. Oh, and the one thing that I wish I had better understood about food, and that took years for me to better understand, is that by really tuning in and listening to my body and honoring my cravings, not getting mad at myself by having cravings, they were telling me something important. That's something that I wish I would have understood better, and I certainly understand it now. On to the sleep and how we are resting. This is crucial, especially as you're preparing for surgery. And how are you sleeping right now? Are you getting enough quality sleep? You know, for many older adults, and especially those of us who are living with multiple chronic conditions, sleep can feel like the long lost friend that we maybe never had or were desperately searching for. And investing in our sleep, that can get really complex, especially based on your environment, the medications that you're taking, and how you feel. Because how many times have you gone towards the end of the day, you're utterly exhausted, you've been nodding off, and then as soon as you get to bed, you're wide awake. I have done that countless times. And that is an awful feeling, to be in that state that you know damn well you are so tired and need to rest, and yet when you finally get to bed and it's time, you can't sleep. What do? How are you managing that? This is another universal need, and something that many people struggle with. Any number of ways that we can better manage sleep, either with medication, without medication, with any number of routines, wind down methods, all sorts of ways that can help guide you to sleep, and deep sleep, REM sleep, quality sleep, that restorative sleep. That's the sleep that we're often yearning for. How are you getting there right now? And are you getting there right now? I've struggled with sleep for years. If we're missing out on sleep, we're also missing out on that restorative time that our body relies on to do repairs, for all of the quiet time, especially for our mind. This is where doing everything that you can to ensure that you're getting better sleep, and maybe it's even just taking naps. When I can, I love when I can get a 15-minute cat nap. That does wonders for me. A lot of people can't nap, and in our busy lives these days, we don't have the luxury. Now here's the solution that I have found, and it's the concept that I refer to as rest. Because when we rest, you don't always have to be asleep to rest. There are different ways that we can rest. Now, in the beginning, the breathing exercise, the palming exercise over our eyes, that was restful. That's not going to replace a good night's sleep. Though, when you can fit rest into your day and get yourself into a rhythm of rest, it helps to better calm your body, calm your mind, and get you to a place to hopefully, ideally, help you to have more restorative sleep. Here's the big ask, and something that ultimately helped me to have some of the best sleep of my life, and that is by adding movement to your day. So yes, as you are preparing for joint replacement surgery, I'm going to invite you and encourage you to remain active. And yes, you have limitations right now. And yes, you're uncomfortable and you are in pain. And yes, this can seem completely counterintuitive for someone preparing for surgery to get more movement. Though, adding more movement to your day is one way that you're going to manage stress, and you're going to be strengthening your cardiovascular system. Our bodies are designed to move, even if you have mobility issues, even if you have limitations. There is more than likely something that you can do, something that you're already doing, and I'm encouraging you to add more, because if you start your day, and I'm talking about the wake cycle, how you feel when you wake up, how you wake up, how that process happens for you. Having movement early on in the day, that can help prepare our body as we head towards the evening to get us ready for sound sleep. You know, even a minimal amount of effort, and think about for joint replacement surgery, our lower body. You're going to need a lot of upper body strength when you're transitioning to a walker, crutches, or a cane. Sitting down and using some dumbbells in the evening while you're relaxing, watching television, even isometric exercises. And the aspect of this that I wish I had understood better early on before I became a joint replacement recipient was looking at my wake cycle. This is something that took me decades to better understand, until I finally got that when I exercise every morning, that's part of my routine. It's part of life for me now, and it's helping me to sleep well every single night, and that has been miraculous for me. I hope these tips have been useful as we've talked about these 3 different areas and the concepts that I've introduced. Those are to soothe, that's how we're going to better manage our pain and our stress, and to nourish, because food is that beautiful, delicious medicine in our world, and of course, we want to rest. We want to sleep more soundly. Step by step throughout this series, I want to help you better understand your medical team and improve and accelerate your recovery time. I'd like to leave you with a gift In the description, you're going to find a link to a PDF, and that's going to lead you to an introduction of the concepts that we've talked about today, about pain, about nourishment, and about rest. It's also going to include an additional handout that are my 4 proven methods to better manage chronic pain. What questions should we answer in the next episode of From the Hip? Leave it below. If you're preparing for surgery, recovering, or caring for someone who is, subscribe and join us next week. Thank you so much for watching.